Good morning, Madam Chair. Thank you, and thank you, esteemed Public Safety Committee, for allowing me to share both the advocacy work that ARC and many other organizations have been involved with, along with much of what we've been hearing from families and people that are currently incarcerated. So just to give you a quick number of dates, on March 13th, March 16th, April 16th, and June 5th, ARC, Uncommon Law, and probably about 40 other advocacy groups began and have been consistently advocating to have people released early for specific demographics. We've been sending our requests directly to the governor. And so we've really taken time to be thoughtful about what this would look like. And so we advocated for the release of people that were 60 and over, especially those that had underlying health conditions. We also consistently advocated for people that may have been released within the next 6 to 12 months. We asked for expedited release of people. We believe it was between 600 and 800 people that were currently still incarcerated but have been found suitable by the Board of Parole hearings to expedite those releases instead of having those people stay inside and wait for 5 months for clearance. We've also advocated for Assembly Minority Leader Maria Waldron's Correctional Facilities Emergency Response Act to be considered. And all of these things, we looked at it from the standpoint of both people who have been incarcerated and how to be thoughtful about how this might impact public safety, and at the same time protect both staff and people that are currently in custody. As we had these conversations, we believe that if the governor is serious about saving lives, then these ideas should be seriously considered. And today is the start of the community supervision program, which will be releasing people that fall into a certain category that would normally be released in the next 6 months. One of the things that has truly troubled me as I hear from, especially in the last few days, and it's been heartbreaking and stressful for me as a person that's formerly incarcerated. So just to share a little, 10 years ago, I was in Soledad Correctional Training Facility, and the norovirus was raging through that facility. And I remember doing everything I could possibly do not to get it. I did not come out my cell. I disinfected the cell. I literally did everything I could possibly think of, and I still ended up catching this virus. And it was brutal. It was painful. And I remember being up at 2 o'clock in the morning, diarrhea, vomiting, just miserable, and banging on the cell door and asking the officer, could he get me to medical? And the officer says, we can't do anything right now, because so many staff have been knocked down by this virus. And I remember laying in my bunk and thinking to myself, am I going to die here like an animal that no one cares for? Not being able to write, we were on lockdown, we couldn't communicate with our family. So when people's family call me and they're worried about their loved ones catching this virus and dying from this virus, and they're hearing about what's going on in Chino, and then when I get phone calls and letters from people that are inside, and we pushed a lot of these letters from people inside, speaking to their fear of catching this virus and dying. They don't want to die inside. What are we doing? What can the governor help us? And these are questions that we have no answers to, because we're not in a position of power, but we can advocate and strongly advocate for those voices. One of the things that bothered me immensely was 16 people died in CIM, and there seemingly, to me, was not enough outrage and uproar of those deaths, to me. And I blame nobody, I'm not pointing fingers, but it seemed like if we had jumped on it then and really took action then, maybe it would never reach San Quentin. Maybe. I don't know. What I do know is that, and sadly, but I have to speak this truth because it's been asked of me by many people in the last couple of days. Why did it take for an institution that's located where there's a great deal of power, influence, and wealth and privilege for this uproar to come when people had died already? And it breaks my heart to be able to have to tell them that I don't know, I don't have those answers. In addition to our advocacy work, When we first heard that there were not enough masks inside the facilities, our sponsors, other organizations, we started donating masks. We've donated over 10,000 masks until we knew that CDCR had caught up with all the mask demand. Understanding that inside you're issued 1 bar of soap every week, and one of the things that the health officials tell you to do is to constantly wash your hands. And knowing that you only issue 1 bar of soap, we've donated over 50,000 bars, and we focused on those institutions that had the outbreaks first, starting with CIM, CIW, and Lancaster. One of the things that I'm seeing now, or that we saw in April, was when 3,500 people were released, there was no support for community-based organizations. We did it on our own budgets to provide transportations from institutions to transitional facilities or homes. Many of these organizations are on shoestring budgets, but they still did it on their own dime. And here we are again, and we're about to release another 3,500 people, and it starts today. And again, there's no support for these community-based organizations. We're literally trying to figure out how to cover the entire state of California and provide transportation for people so that they're not on public transportation, and make sure that they have PPEs when they step out of institutions if they don't have them, so that we'll have them and we're able to give them to them. The last thing I'll say is this. We've been asking for specific demographics, the 16 people. So first of all, I've heard it, the separation of there were 22 people in custody that died and 2 correctional officers. There were 24 human beings that died from this. I don't differentiate the two. The correctional officers are there to do a job, and they're human beings, and they have families and loved ones. The people that are in custody have broken the law and are now being held accountable, but they too are human beings that have families and loved ones. What are the demographics of these individuals that have passed away from COVID? Would they have been protected or saved if they were over 60 or had underlying health issues? Would they have been protected and saved if we had given them release? If we take a moment just to look at, if possible, maybe reach out to the minority leader and look at the Correctional Facilities Emergency Response Act. It's not just for COVID, it's for anything like this. And I go back to when the norovirus was ravaging Soledad Correctional Facility, it was like, you just have to wait for it to take its course. That's literally what it was like. I've heard from people inside that in some instances, there's robust cleaning inside the facilities multiple times. There's social distancing, only one building can go to a yard at a time. And that there's literally a joint effort with both staff and people in custody. And I've heard the exact opposite of some facilities too. But there's no cleaning, and some people are not taking it serious, and that includes staff. And so I have a mixed batch of these reports from people that I know and I trust that they're being honest with me. The thing that I would hope that we would look at is Lancaster, which was one of the first institutions that had an outbreak. They have 0 active cases right now. What did Lancaster do right? They had 2 facilities, A facility and D facility had the cases on them. What did they do right in order to, 1, make sure no one died, which may be impossible for us to do, but more importantly, what did they do in order to stop the spread inside their facilities? And if we're not looking at those things, then maybe we should be looking at those things. I'm also here to just say whatever we can do, and I believe I speak for most, if not all, community-based organizations that want to help. Whatever we can do, whether it's providing transportation to and from institutions upon release, whether it's to encourage people that are currently incarcerated to wear masks, we are here to be of service and to help the people that are currently incarcerated, as well as the staff that are in these facilities. Thank you for your time.
Thank you, Mr.